I'd like to take just a few moments to run through the timeline of WFF activities over the years so you can get some idea of where we started and how far we've come. My first experience in Africa was in 1975 when I was doing anthropological field research on traditional medicine in northern Nigeria. Here I am with my beloved Honda motorcycle hiding behind a magnificent beard. But it wasn't until the mid-1990s, after I'd been to medical school and trained as an obstetrician, gynecologist, and urogynecologist, that I was able to go back to Africa with a special focus on childbirth injuries and fistulas. In 1994, I met Dr. Catherine Hamlin, founder of the Hamlin Fistula Hospital in Addis Ababa, Ethiopia, and inspired by what I saw, I came back to the United States, and with the help of good friends in Chicago, I founded the Worldwide Fund for Mothers Injured in Childbirth in 1995. We gave it the shorter title of the Worldwide Fistula Fund a few years later for convenience. We spent a lot of time fundraising, increasing our contacts and activities, and in 2008 we managed to partner with SIM in Niger to break ground on what would become the Danja Fistula Center. After 4 years of hard work, construction difficulties, and government obstacles, we opened the Danja Fistula Center in 2012, making it the best equipped, most compassionate center for fistula care in West Africa. Around the same time, I met a remarkable Ugandan woman named Alice Imasu, who showed up at Washington University in St. Louis, where I'm on the faculty, working on a master's degree in social work. And her vision was to create a dedicated fistula treatment and care center in Uganda. We first partnered with her in 2010 and began to raise funds to help her realize her dream. In 2018, we were able to award Terwodi our largest grant ever, $675,000 over 5 years, to help triple the number of women that she was able to treat at her center in Uganda. And in 2019, the Terwodi Women's Community Hospital opened in Soroti, Uganda, after 10 years of hard work on her part. And now it's probably the premier fistula center for treatment, rehabilitation, and holistic care in all of East Africa. In 2014, I was privileged to spend time in Ethiopia as a Fulbright scholar. And through the connections I made before and during that time, we were able to improve OBGYN residency training at Mekelle University. Then in 2015, with the aid of Hamlin Fistula, Mekelle University, and Footsteps to Healing at Oregon Health and Sciences University, we were able to launch the first urogynecology training fellowship program in Ethiopia, which is now highly successful and is going to transform gynecologic care in that country. Along with that, we launched a physical therapy training program at Mekelle University to aid in those efforts. In 2017, we launched holistic care services in Burkina Faso with Dr. Itengri, who had been the head of fistula care at the Danja Fistula Center. And in 2018, we partnered with and merged with, One by One, a Seattle-based fistula organization, and brought into the WFF fold their programs in Kenya, where we've now launched a successful, safe motherhood curriculum. So we have created an enormous network of hospitals and institutions spanning West Africa, East Africa, engaged in training, research, fistula care, social reintegration, and patient advocacy. All of that's detailed in my 2018 book, Tears for My Sisters, The Tragedy of Obstetric Fistula.